In 2000, I became a CODA at Spain Rehab, which is an occupational therapy assistant. So that was where I became introduced to hand and paw. And I had never heard of bringing the dog into a hospital, but we were trying to do anything that we could. So we brought the dog in, we placed the patient's hand on the back of the dog, and this was a patient who was non-responsive to anything. And once the hand was placed on the back of the dog and she was encouraged to pet the dog, her hand started moving and she began to interact with the dog. And I was hooked on hand and paw then because I saw a miracle that through the use of a dog that we can touch people. On April 27th, 2011, my life changed when tornadoes ravaged the state. I don't know where I was at the time the tornado hit. I have no recollection. I do know that when I was found about a block and a half away and with severe injuries. I don't have any memory from April 27th until my first memory is July the 4th. I do know, because people have told me, that Hand and Paw came and visited me even during that time.
Well, we went into the dark room and I didn't quite know what to expect. I actually didn't expect you to be that bad. And so, we were just real quiet and it was real dark, and Melissa just had us put Sally right on her bed, and Melissa kind of took her hand and was petting her, having, Penny pet her and explaining to her who we were, and we didn't stay very long. We were instructed we were only going to stay just a couple of minutes because they were really worried about overstimulation, because I think with traumatic brain injuries, that's something you really worry about.
So there I was, not a therapist in Hand and Paw treating a patient, but I now was the patient receiving the love of Hand and Paw. The therapist and the employees loved visits from the Hand and Paw just as much as the patients did. It brightened our day to see those little forelegs and that little tail just wagging to come do their job.
We at UAB are very blessed to have Hand and Paw throughout our hospital. And I can't say enough of how much value that brings to the quality of care that we provide our patients, and going over and beyond just taking care of their physical needs, but addressing their emotional needs as well.
What's her name? Sally. Sally. That's a good name.
Using it to incorporate them to use their skills, to regain function, balance. We use it with speech therapy as well, but just the psychosocial aspect of what Hand and Paw and the pet handlers bring to us is just phenomenal.
Through Hand and Paw, I was given a gift that only a special person and their therapy dog could give me. They touched me inwardly and gave me the strength and the courage and a moment of happiness to want to push on, to want to recover. But not until I became involved with Hand and Paw did I realize the commitment of volunteers, the time and money that it takes for them to go to take their pet, to prepare their pet to go and visit and do this ministry that is such an important part to so many people's lives. And I'm proud to say that I'm affiliated with Hand and Paw.